Hi, welcome to my second video from Post Hip Tips. Today we're going to be talking about preparing for your hip surgery. So one of the first things you're going to want to do is gather your equipment. Some of the equipment you might need would be a cane, a walker, or crutches, depending on the surgery you're having. Myself, I needed some crutches, and in that case you might want to try your crutches out first. Some of them can be more comfortable than others. We'll talk about in later videos how to fit this equipment to you so that it's most effective for use and least uncomfortable. In your house, you're going to want to prepare things so that it's easier to move around after your surgery. You're going to want to definitely move any unsecured rugs that you might trip on. Objects to easier heights, like you could put pots and pans on a higher shelf or place some things on your counter in the kitchen. As well, get what cleaning you can completed before your surgery so that you've done a little extra stuff if you can, if you're not in too much pain, so that it's a little easier after your surgery. Another thing that you can do is to learn about your procedure so that you can have more of a feeling of what's going to happen and a greater sense of control, really. Nobody likes to go into an unknown situation. So you can learn about the procedure by talking to your surgeon beforehand. You could talk to your doctor as well. There's several online resources. Orthopedics websites can be another good site, another good resource. So you should start your exercises early so that you know them. If you can get a list from your doctor of what exercises you might have. A lot of people with total hip replacements might have really clear instructions and even little classes that they might go to before their surgeries. Myself, I had a one-day surgery. It wasn't a total hip replacement, it was a hip arthroscopy. So I wasn't really given any training for my exercises or what to do after at home as far as how to move around, those sorts of things. So again, if you do have any exercises in those lists or training that you get before your surgery, make use of those. There's nothing like learning these things just when you've come out of surgery and you're all groggy from anesthetic, so it's best to learn them beforehand. You're going to need a lot of help. A lot of us have been really tough up until this point, living in a lot of pain and getting around with restricted movement in our hips because we needed the surgeries that we're getting. But you're going to need to call in some of those favors from friends and family over the next coming weeks. Some things you really just can't do on your own. The point of these videos is to show you what you can do on your own, but some things are just really difficult to do on your own after a hip surgery with precautions and when you're tired from the surgery. One thing is cutting your toenails and then taking care of pets. You may be able to move those pet dishes up off the surface, but I don't know where you're going to put that litter box for a cat, for example. Many people who have undergone hip surgery can't bend that far for a couple months, so expect to budget a couple pedicures into your recovery time as well. Cutting your toenails, even with long-handled toenail clippers, is just something that's really difficult. I've actually spoken to a couple occupational therapists, and they've let me know really there just is no way to cut your own toenails when you're on hip precautions, so it's something you're going to need help from somebody else, or if it's winter, you can let them grow. Otherwise, ask someone who loves you a lot, like your mom or a best friend. I was lucky it was winter when I had my surgery, so nobody could see my feet or legs, luckily. Depending on your weight-bearing orders from your surgeon, you may have to stand on one leg to prepare food. Expect this to be very tiring. You'll require frequent breaks, and things may be more difficult than you anticipated. We'll talk about food prep in later videos. I made a bunch of frozen meals for myself, actually, and I don't have a microwave, so I had to stand with all my weight off my operated side to heat things up on the stove, and it was very tiring. Actually used a bath seat when it was dried off from my shower to sit in the kitchen so I could prepare my food and take frequent breaks. After surgery, I just found that I got tired way more easily and that my body stores of energy had been tapped by having surgery. Also, I was in a lot of pain before my surgery, with not only my hip hurting very badly, but also my SI joint was out of place slightly as well. This is very painful to anybody who's had this. It's easy to get deconditioned before surgery as well when we are in so much pain, but it's really important to keep moving. This will help make your recovery more effective.